Okay, thank you, everyone. Welcome to the first Cynosure HQIC Patient Family Engagement for Equity Think Tank of 2024. I really appreciate all of you joining today. We have a really quick, fast-paced think tank coming up today. These 30 minutes always fly by, so we appreciate you taking a few minutes to join us today. As we get started, if you wouldn't mind, please introducing yourself in the chat. Just your name, your role, which organization or hospital that you are at, and the state you are in as well. That would be really helpful for us just to see who all is here. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. We have been working closely with Cynosure HQIC and all of the state hospital associations and partners and hospitals to support utilizing patient-family engagement for equity as a strategy to get to the outcomes that we all want to see in healthcare. So today, I am really excited to kick off this new year with a discussion about moving from patients' stories, because we hear so many incredible stories, to developing strategies using those stories that will, again, help us get to those improved outcomes that we all want to see. And then on our last think tank in December, the conversation around patient experience scores was brought up. So I wanted to revisit that discussion about patient experience and then how utilizing patient-family engagement for equity can be used as a strategy to improve patient experience scores. So we'll have a discussion about that. And thank you, everyone, for chatting in and introducing yourself. We've got Barton Health. Hello, Cindy from Yuma District Hospital. Katie, we got more folks joining. Alexia from Chicago. Awesome. Nancy, welcome, Nancy. And Peggy, hello, everyone. Thank you all for chatting in. All right, so before we get to our discussion, I just wanted to take a minute to wish everyone a very happy 2024. I was on a meeting yesterday where we were talking about when do you stop saying Happy New Year? And if I haven't seen you yet this year, I'm going to tell you Happy New Year, even if it's February 1st. I'm still going to tell you Happy New Year. So happy 2024. I hope it is all finding you well and healthy and ready for an amazing new year. So happy New Year. All right. So just a reminder for those who are new to the think tanks, this is really an opportunity for us to connect online and learn from one another. So it's not only about what I have to share, or I saw Libby just joined, what Libby has to share, but also we want to learn from all of you as well. This is really a peer learning opportunity, and it is open to anyone who is interested in learning more about engaging patients and family caregivers in hospital improvement work, and anyone who just has a desire to learn and share strategies that work for them. These happen on the second Wednesday of each month at the same time, the same place, and conveniently enough, our next think tank will be on Valentine's Day. So that's really exciting. We'll get to share the love with each other at our next think tank. All right, so let's jump right into it. And so I wanted to introduce this concept before we get to our discussion today about moving from story to strategy to get to outcomes. And this actually came from one of our quality improvement or healthcare quality improvement partners who described, the benefit of hearing patients' stories. A story that we hear can, really pull at the heartstrings and inflict some motivation onto our healthcare teams when they hear stories whether they are, really positive outcomes or not so positive outcomes. You can really learn a lot from stories that are shared by patients and their family caregivers. But then it's what do we do after that? So, you may have heard a story that a patient family partner has shared on a past Cynosure webinar or workshop, or joined one of the patient family partnership hubs and heard experiences and stories from there. Um, and so the question we are asking is then what's next? It's taking what you have learned from that story and developing strategies around it. So we've heard some really incredible stories, and one that's sticking out to me right now, just because we're so deep in the social drivers of health work right now and developing effective social drivers of health screening programs, is a story that one of the Cynosure HQIC patient family partners shared with me in an interview about being screened for social drivers of health. And she just discusses the vulnerable position that she is put in when she's being asked questions about food insecurity, when maybe that week she wasn't able to provide, all of the food that she could to her family. And so just hearing that vulnerability and that vulnerable position that she was in, triggered me to think, what are ways that we can make these conversations around social drivers of health really effective, and not put patients in such a vulnerable position, have them feel supported and understood, and know that they won't be judged for whatever they share. So creating strategies around that. Excuse me. Sorry, the dry throat. So creating strategies around that in order to get us to outcomes where, if a patient feels comfortable in sharing and being honest around their social needs, so they can be connected to resources within the community that are needed because they had a positive screen. So getting to those outcomes that we all want to see in healthcare. Um, I'm curious if anyone else has heard any stories that have really triggered you to think creatively about strategies that you could put in place to make sure those experiences change or the outcomes are different. Are there any stories that have stood out to you? And you don't have to share the story. You can just simply raise your hand or put a yes or no in the chat. Any stories that have inflicted you to want to change something? And Sarah, we will send out the link to the recording probably early next week. We have a whole playlist of think tanks from the last year that we can share as well. All right, so I'm thinking maybe you haven't yet maybe had the benefit of hearing a really motivating story that, pushed you to change or make a change to a policy or a practice or create a new strategy to get to a new outcome. And that's okay. And that's helpful for us to know as well, because we have a lot of stories to share, and good to know, so we can share along with you if that's of interest to you. All right, so to highlight this point a little bit further, I wanted to use the example here on the next slide, focused on improving patient experience scores. So this was a topic that came up in the December think tank. we had a discussion about goals for 2024, and a lot of the participants on had shared some of their goals around improving patient experience scores, and even improving response rates to the patient experience surveys. So I wanted to just have a conversation about this and thinking about, moving from story to strategy to get to those outcomes. Keep that in mind as we go through this discussion. So I have a scenario here. Patients at Hospital A report not having a discussion with a nurse or a physician about having the help that they needed at home. I'm realizing that it's worded a little strangely because I have having in there twice, but this is a patient experience metric. It was, did you have a discussion with a nurse or physician about making sure that you have everything that you need at home? So for this specific hospital, patients are reporting that they did not have that discussion. So in thinking about how we can get the story behind the data that we see in the experience scores, what are some things that Hospital A can do to gather that story? I'll throw out one idea and then welcome others. One thing that we encourage a lot is to have a listening session around a specific topic. So hosting a listening session open to patients who have been discharged from the hospital to hear, their experience and their story behind this specific topic. When is the best time for the nurse or physician to have a discussion with you about what's needed at home? How can we ensure that, these discussions happen to gather new strategies and new ideas from those stories? So one thought is a listening session. Other ideas on how this hospital can gather the story behind the data? Feel free to chat in or come off mute. This is that peer learning interactive portion of our think tank today. Oh, Andrea, follow-up phone calls. Yes, that is a great way to continue gathering those specific experiences around this patient experience metric. And I think I have, I've heard from, I wish I could remember the hospital name, but they started doing discharge interviews as well. So not specifically a follow-up phone call, but they would follow up with patients and have a specific set of questions that they would ask. And so if your hospital, you look at your patient experience scores and you realize there's a few metrics that you could improve on, adding those to your follow-up phone calls or discharge interviews can be really helpful in identifying, some new strategies that you can put in place by hearing some of the experiences and stories. Thank you, Andrea. Olivia, we have the discussion during the admission process. If the patient screened positive, it will generate a social service consult. We also do follow-up phone calls after discharge. Gotcha. So that's more focused on the social drivers of health example that I was talking about as well, which we'll definitely be talking a lot about this year. Thanks, Olivia.
Oh, I saw Andrea's comment too, Lindsay, sorry to jump in, but I think that is so relevant that sometimes patients, we have so many people coming in and out of the room, we don't recognize the role necessarily.
Yeah.
And so, how can we more strongly communicate that visit and the purpose of that visit and who that person is that they can connect to. I think that's, sort of an easily overlooked piece to this
Mhm.
communication. Yeah.
Absolutely. Yeah, no, that's a great point.
And I also
Yeah.
just wanted to chime
Oh,
in
yeah.
on sorry, I'm going to keep going.
No, that's okay. Go, go,
I
go,
have
go.
been having so much trouble with my mute button. I'm so sorry. Um, I don't know why it did not. Anyway, the other part of that is like, what's the value of really hearing the story? Because the story sounds kind of, static a bit. But in opening that conversation, and I love the follow-up phone calls and following up on positive screens, brilliant touch points. And the really the big value there is you find out why.
Yeah.
So that if you then have a conversation with, 10 people who reported that they didn't have a discussion, maybe you find out it was that they didn't recognize the person as that conversation. And so that's the problem you need to solve. Or maybe it's that only people on a certain floor or service line had that conversation, but there wasn't there wasn't a conversation on the surgery floor or whatever. So understanding the kind of narrative underneath it is an opportunity for you to narrow in on where your opportunities for improvement really are, without sort of making those assumptions.
Mhm. Exactly. Took the words out of my mouth, Libby.
Well, that's because I interrupted you and kept talking. My apologies.
No, that was very well said. Yeah, I was just going to say, because we could look at our patient experience scores and hypothesize, why they're like this. And but you're right, we won't really know why until we ask the questions and have conversations with those who have been through these experiences. Absolutely. Great. Any other thoughts? I also have a question here. What are some questions that would need to be asked in order to get to those specific experiences that we want to hear, um, based on this example that we have here? So, would we want to ask, did anyone or who came and asked you if or had a discussion with you about needing help at home? That could help you identify, are they assuming other roles within the hospital, like to your point, Andrea, are having those discussions. But what are some other questions that we can ask to get to that why that will lead us to a strategy? I think maybe there's so many questions that we could ask to get to the why. It's hard to think of that one. One of the things that I always think of is, the timing of certain discussions that take place during a hospital stay. Yeah, back in 2016, I was in the hospital for 9 days. And on that last day when I was ready to go home. I was getting all of this information thrown at me about my condition and what I needed to do next and my follow-up appointments. But I was so focused on just being in my own bed, putting on a comfy pair of clothes that like everything was just going through my head. So maybe not the best time to have certain discussions to make sure that I had everything that I needed at home or if I had any questions. So and this is something that we talk a lot about have talked a lot about through our conversations over the last year or so is moving discussions upstream. So um, upstream in a hospital stay. So, even asking about the timing to have conversations like this, what would have been the best time in your hospital stay to have this discussion. Yeah, Libby asked who they spoke to about their discharge. That's a great one. What do they understand about their care needs after discharge? That's a great question. I like that.
The thing I like about that question is it changes what the survey question is.
Right.
Because the survey question is usually, did you understand?
Yeah.
Or if you understood. Well, it's like that question at the beginning of a primary care visit. Any changes in your medication? Well, I don't know because I don't know what you have. So I can say, no, I haven't changed my medication. But if you have a list from 3 months ago and I changed it 2 months ago, we're not on the same page. So it's the same thing. If you ask, did you understand? Yeah, I understood perfectly, but maybe I didn't understand what you wanted me to understand. So I think kind of even doing, it's a little bit more of a teach back moment, but even doing that in a follow-up phone call can be really helpful, again, because what you want to do is get to what is the person's, actual problem. And I think that little shift of did you to what did you
Right.
is really helpful in doing that.
Yeah. Agreed. And I think that's the benefit of, hearing these stories and experiences is the ability to dive deeper into those patient experience questions, because I believe the majority are all yes, no, not sure. So you could take any one of those patient experience questions and flip them so you can dive a little bit deeper and get more information. And you can apply this process to anything in your hospital that needs improving. If it's fall rates, sepsis, you name it. The list can go on and on. I can't think of so many examples, but yeah, just flipping those questions to dive deep and get more information that will help you develop improvement strategies. And I see Tammy and Cindy's comments in the chat as well. Tammy says, ask if there is a specific person that has been with the patient who might have had conversations with the nurse or physician. So like a family caregiver or friend. And Cindy shares, we ask if there is a family member or caregiver they would like to include in the discharge discussion. That's amazing. Yeah, I believe my mom was part of my discharge discussion, so she remembered everything and took all the notes, so I could kind of shut out for a second. So that's, yeah, absolutely.
So could I ask Tammy to clarify, is that what you meant, a family caregiver?
Oh, yeah.
Or were you thinking, I was just a little bit confused. I want to make sure I understood. You can either type in or come off mute and answer.
No, I was just suggesting that if there was someone else that was with the patient that maybe the nurse or doctor didn't know about, to, what did I say? Hold on. Ask the patient if there was someone else in the room with them when they were talking about discharge, because they may have forgotten about it and saying, I didn't know anything about it, but perhaps there was somebody. Just refreshing the question. Was there anybody else in the room when we were discussing this with you that might help
Oh,
to
That
centralize?
makes,
Sorry about
no, I'm glad I asked. I just wanted to clarify. So that's a great question. Yeah, to have that prompting,
yeah.
to think about who else might have heard it. Mhm.
because they're scared or may not remember. I know
Yeah.
I am. When I'm in the doctor, it's like you're scared to death. You forget everything else, and all
Yeah.
you're concerned on is what you're going through. So
Right, exactly. And I like that question too, because it helps you it helps the patient kind of recenter themselves and go back to where they were at that time of discharge, at that moment, and kind of think through some of those specifics to help get to, yeah, more of that experience, what they experienced. Great. Thank you, Tammy. Great discussion. Any other thoughts or additional questions we're not thinking of around this topic?
And I know we had talked about sort of vamping the readmissions interview guide to be even a little bit more general. But in that guide, there are a lot of suggestions and ideas for thinking about, you know, even your own mindset of having this conversation,
Yeah.
and getting how to elicit the story and sort of how to respond to it. Because sometimes, you know, staff work so hard to produce great outcomes every day, and sometimes you might hear something that, you know, nobody ever came in and talked to me, and yet you see in the chart that caseworker did make a note that they talked to him, and so you kind of are a bit defensive about that instead of you know, leaving the space to explore how we can make sure that person knows that's the caseworker. So I would encourage you maybe to take another look at that interview guide, and relate it really to any patient experience score, or I'm sorry, patient experience metric, or any other quality improvement objective.
Absolutely.
Can we send that in follow-up?
I was just going to say that, yes.
Thank you.
That's what I was writing down.
I was going to try to find it real fast, but there's no
No,
way
yeah,
that we don't have these sticks. I would.
we'll send it and follow up along with this recording that was asked for as well, and we'll get that out next week. All right. Well, in our last couple minutes, just wanted to see if there were any additional questions, other things that are top of mind around patient-family engagement for equity as we kick off the new year, things for us to consider, be aware of that your hospitals are focused on. Well, if there are, and you need a few extra minutes to think about it, I encourage you to please follow up with me. I know that says see you next year. This is the only slide I forgot to update, but we will see you next month. That is my mistake. But before then, you know, if anything else comes up, if you you know, have more questions about what we talked about here today, you want to apply this strategy to gather stories and other improvement areas in your hospital, please reach out to me. I'm happy to jump on a quick Zoom with you and talk through any additional strategies. So my email is there, and then yes, we will follow up with everyone next week with the recording and the readmissions interview guide that Libby mentioned as well. And with that, we have a minute left, so I will stay on if there are any other questions. But if not, I thank you all so much for joining in the discussion today. Thank you, Cindy and Tammy, and Andrea and Olivia, Sarah, everybody else for joining in the discussion. I really appreciate you taking the time and chatting with us. And if we don't see you before the next think tank, we'll see you on Valentine's Day. All right. Thanks, everybody.
Thanks, everybody.